Imagine a world without antibiotics. It isn't hard to do. Take a look back into our recent past where an infected limb could result in an amputation and people could die post-operatively from what is now considered to be minor surgery. Before antibiotics, it was not unheard of for healthy people to die of diseases such as pneumonia, and the recovery period for many illnesses was much longer. These days, commonplace infections are now quickly and easily treated with a simple visit to your GP, but after half a century with antibiotics, we are looking at the prospect of again having to live without them. Antibiotics work in a number of different ways. Beta-lactam bacteria such as penicillins work by inhibiting cell wall synthesis. Others inhibit protein synthesis, nucleic acid synthesis, and the synthesis of folate. Some bacteria are naturally resistant to particular antibiotics. However, bacteria may become resistant in two ways. They can acquire a genetic mutation or acquire resistance from another bacterium. It is a perfect example of survival of the fittest. Resistant bacteria have a greater chance of survival than those that are susceptible. Susceptible bacteria are killed or inhibited, resulting in selective pressure for the survival of the resistant strains. Some mutations enable bacteria to produce enzymes that inactivate antibiotics, while other mutations alter or eliminate the target molecule that the antibiotic attacks. Some close up the entry ports that allow antibiotics into the cell, while others manufacture pumping mechanisms that export the antibiotics back outside so they don't reach the target. The most common form of resistance comes from the bacterial production of beta-lactamase, an enzyme that cleaves the amide bond of the beta-lactam antibiotic ring before it can interact with the penicillin binding protein on the target membrane. It can then be transferred from resistant bacteria to non-resistant bacteria by a process known as conjunction. In some countries and online, antibiotics can be purchased without a doctor's prescription. Patients often take antibiotics to treat viral infections or do not follow directions given by their doctor. Global travel and medical tourism are also issues, as well as lack of newly developed antibiotics. Antibiotic resistance not only makes bacteria harder to kill, it can actually make them stronger. Once a bacterial strain is resistant to several different antibiotics, it is referred to as a multi-drug resistant microbe. When there are virtually no antibiotics left to fight a bacterium, it is said to be pan-resistant. These strains are becoming more and more common in hospitals and the community at large. Methicillin-resistant Staphylococcus aureus, or MRSA for short, is usually found in hospitals and is resistant to many antibiotics. In the public, MRSA infections are usually found in the form of skin infections. In medical facilities like labs and hospitals, MRSA can cause deadly bloodstream infections and pneumonia. These bacteria can survive for a long time on surfaces in the hospital and can enter the body through catheters, open wounds, and ventilators. Drugs used to treat resistant gram-negative bacteria come with serious adverse side effects such as renal impairment and elevated creatine levels, making them difficult to treat. Another problem is multi-drug resistant tuberculosis. This disease is caused by bacteria that have become resistant to drugs like rifampin, which was previously used to treat TB. Good hygiene is very important as this prevents the spread of infection so that fewer antibiotics are required. It is vital that we educate people on the importance of compliance, as many people do not finish their courses or take drugs as prescribed. It is also up to medical professionals to ensure that antibiotics are reserved for cases that really need them. These are simple steps that can be followed by everyone. However, hand washing and related measures can only control the spread of resistant bacteria. Vaccines are being developed to immunize people against antibiotic-resistant bacteria. These, along with pre-made antibodies, can be given to people who are at risk or infected with drug-resistant microbes. Farms in many countries use antibiotics for the promotion of growth and prevention of disease in livestock. Resistant bacteria work their way along the food chain from animals such as chickens, eventually ending up in the blood samples of infected patients. This is known as the farm-to-fork phenomenon. Stopping the overuse of antibiotics will slow the growth of the resistant bacteria and prevent consumption through food. Collecting data on the use of antibiotics can determine specific problems and where they arise. A study conducted by the European Union over 15 years showed that countries with the highest antibiotic use also showed the highest number of resistant bacteria. This demonstrates the strong association between antibiotic use and resistance, and also identifies where corrective intervention is needed. Another approach is developing drugs that interfere with the mechanisms of bacterial resistance. This can be done by stopping the duplication or movement of genetic material from one bacterium to another. Beta-lactamase inhibitors such as clavulanic acid can also be given in combination with penicillin to prevent the inactivation of the antibiotic. At the end of the day, Resistance is inevitable, but these approaches will help slow the process and reduce the damage caused by the superbugs.